Hello, this is Dr. Mercola, and today we are joined by Alan Cassels, who is a drug policy researcher at the University of Victoria in British Columbia. And he's the author of a great book called Seeking Sickness, a Medical Screening and the Misguided Hunt for Disease. This book is loaded with information on medical screening and really focuses on an important topic, which is prevention. It's been a long time standing passion of mine, which is to prevent disease rather than to treat it, because it's so much easier to implement a preventive strategy. And there is an enormous amount of effort and research that's invested in the traditional community into these screening procedures, and they're really a focus on using that as their preventive medicine. And we'd like to dispel some of these myths today, and Alan has done a tremendous job of researching this and kind of exposing some of the frauds that are associated with this industry.
I've been following the marketing tactics of the pharmaceutical industry for almost 18 years now, and I've written several books about the drug industry. You know, I kind of came upon screening partly because I started to see that a lot of people who ended up being put on certain regimes ended up there because they had been through some screening regime. So perhaps maybe a screen for their blood cholesterol, or a screen for their eyeball pressure, or, you know, even something simply as benign as screening for high blood pressure. So I started to look upstream from the pharmaceutical industry and really looked at the kind of tactics that were used to really entrap more and more people into drug regimes. And screening was something that it's very pervasive. You see it everywhere. There are pleas of all kinds asking people to think about prevention instead of waiting for disease. You know, that the idea that your best protection is early detection. And I really thought that this is something that needed to be put closer under the microscope.
And I'm wondering if you could briefly summarize what you've concluded from this 18 years of research, and if you could just offer some specific recommendations for people based on this research, and then we can go into some of the specifics.
Sure. I think probably the biggest soundbite that I would say is that so much what we consider to be disease in the sort of orthodox medicine world has been created, has been shaped, has really been molded by the pharmaceutical industry. And very much of what we consider to be medicine is determined by, you know, the kinds of things that end in what the drug industry calls a drug successful visit. So anything that, not just anything that we potentially could be sick with, but anything that any healthy person could get. And really, screening is about looking in healthy people to find signs of disease. And I want to distinguish right off the bat that when I'm talking about screening, I'm talking about people who have no symptoms, who are otherwise healthy, who have really no reason to consult a doctor, are being told, you need to be proactive, you need to seek out early signs of disease, and that's a good thing to do to keep yourself healthy. People that actually have symptoms, feel a lump or whatever, and then go in for a test, that's a diagnostic test. That's something different. I'm talking about screening tests where you're taking otherwise healthy people and trying to find signs of disease in them.
So if you're watching this and you're healthy, have no signs or symptoms of a disease, and you want to optimize your health, what recommendation would you have for an individual like that falls into this category?
Well, I would think that the recommendation would be listen to your advice, and that you can avoid a lot of the adverse effects of medicine by doing things to otherwise stay healthy. So
maybe avoid some of these screens rather than utilize them.
There are some estimates that as many as 2% of cancers in the United States might be due to radiation that is given to patients from CT scanners and so on.
And another popular variant of the CT scan for screening would be coronary arteries. I think the ultra-fast CT scans. that can give you what's called a calcium score, which is an indirect reflection of the calcification of your arteries and supposedly correlated with an increased risk of heart disease. And
Right.
do you have any comments on that one?
Well, calcium scoring is actually a very good example of really misleading the public into thinking that they can do something to prevent yourself from having a heart attack or stroke. Kinds of things that you see advertised: come out and get your calcium score. This will save your life. That kind of thing really falls apart under scrutiny. When they look at the benefits of calcium scoring, the actual information that you get from that does very little to actually improve your overall health, your longevity, your risk of having a heart attack, though it's promoted widely.
Yeah, now, actually, before we go into the other test, I just want to take a little tangent here and go on, really discuss some of the screens that might actually be helpful. Mm-hmm. Because there are some. I mean, there's no question, and I can give you two right off the bat. And usually a screen is, again, from a person who doesn't have any signs or symptoms of disease, but yet ideally can predict your risk for future disease at virtually no harm to you, which is an important caveat. Yeah. So the first one that would come to mind would be a vitamin D screen, because you don't know what it is, and it's just a matter of simply exposing your skin to sunshine or taking an oral supplement. So that's a simple test, virtually no risk. Would you agree that would be a decent screen?
Yeah, I didn't look into that. I think vitamin D, absolutely important. I don't really know a lot about vitamin D, but I think it's in the category absolutely of something that would be worth looking into. One thing that we know for sure is that a lot of the activity around screening makes a lot of money for a lot of people. And one example might be the whole world of mammography. So this is breast cancer screening, where we're telling healthy women who have no symptoms, go in every year from the day you turn 40, go in once a year and have your breast radiologically screened. What we're not telling women is that just the act of screening involves a whole downstream potential for harm, and also involves huge amounts of sort of medical resources in terms of the radiologists, the surgeons, and so on. It's a huge industry. You might say, well, what's wrong with that industry if it's actually saving lives? When you sit down and you look at the number of women that have to be screened in order to have one woman benefit, it's actually quite shocking. Most women would say, well, I would want to be screened because screening found a lump or my mother, and their lives were saved. The question I had was, well, how often are people's lives being saved by mammography screening? And the best studies, and these are studies that are over 10 years long, these are studies done in Canada, the US, and in Europe, have found that you have to screen 2,100 women every year for 11 years to prevent one death. So to answer the question, is it life-saving? Yes. 1 in 2,100 women would benefit from being screened over an 11-year period. But at the same time, of those 2,100 women, about 600 to 700 of them will have a false positive. They will find something unusual, something abnormal, and that will require biopsies, often surgery, and mastectomies, and so on. Not to mention the psychological harm of inflicting a cancer scare on 600 or 700 women who would not have benefited otherwise from being screened. So the problem there is that you're generating a huge amount of activity to save, 1 in 2,000 women. In the best case scenario, you're causing 600 or 700 women to have huge amounts of procedures. And you might say, well, doesn't that seem worth it? It seems to me that's an awfully high cost to pay to prevent one death. And I think that there's many, many other things that we could do to try to reduce the risk of breast cancer in women, rather than telling them to get their annual mammography screen. after the Women's Initiative study in 2003, this was the big study of hormone replacement therapy, which found that those drugs increase a whole range of risks. Overnight, millions of women stopped taking hormone replacement therapy, and guess what? The cancer rate has continued to drop because of women stopping to take hormones. The other example that would probably be of interest to your viewers is the male version of mammography is the annual PSA test. And this is a test where it's just a simple blood test where they can measure a level of an antigen in your blood and come to some determination of whether you are at high risk of developing prostate cancer. What most men aren't being told, and this is from the research that I've done, they're not told when they're given that test, the likelihood of them finding prostate cancer cells in their prostate are fairly high. And in fact, it's directly proportional to your age. If you live to be 60 or 70 years old, there's a good chance you're going to have a 60 or 70% chance of having some evidence of prostate cancer. You might say, well, if you've got prostate cancer, shouldn't you do something about it? Well, certainly with the PSA test and its lack of really specificity and accuracy is that you've got 60 or 70% of the population that will develop, the male population will develop prostate cancer in their lifetime, but only about 3% of men will die from prostate cancer. So what doctors have told me is that most men will die with prostate cancer, but not because of it. And that's really kind of a mind-blowing concept for a lot of people because they think what you're saying is that I can have a cancer in my body and live a perfectly long and healthy life. Absolutely. So one of the things that screening is good at is finding signs of disease. What it's not very good at is finding disease that matters. And in this case, having an elevated PSA level could be caused by a whole range of things. And if you're otherwise asymptomatic, going down that line of getting tested will lead to biopsies, possibly surgery, other kinds of treatment, including chemotherapy, hormone therapy. And at the end of the day, a lot of the men that go through that mill end up becoming incontinent or impotent because of the treatment. Someone once quipped with me, with the PSA test, your life may not be longer, but it will feel longer because of all the side effects of the downstream effects of being treated. I guess the summary statement really being, go into screening with your eyes wide open. And that is to say that it's not an emergency procedure. If you're being offered a screen of any sort, whether it's a mental health screen, a screen of osteoporosis for blood pressure or cholesterol or for cancers, take the time to ask the questions, how could I be hurt by this screening? And when you actually understand that all screening can harm you, you might take a very different approach to rushing into it. You might take more time to actually do some research. And really, when you do research, it's important that you look at independent sources of information. I mentioned the United States Preventive Services Task Force. Their stuff is all available on the internet. In terms of the spectrum of trustworthiness, I would place that in the more trustworthy category, as opposed to the other category, which might be those groups that stand to benefit from screening and over-promote and over-promise on the screening's benefits. So really, independent information is I think, key, and knowing that screening can potentially harm you.